Welcome to Inside ELAS, the podcast where we explore how AI is transforming the way we do literature reviews. I'm your host, Josien Boetje, and next to me is AS Review founder and AI expert, Rens van der Schoot. Each episode, we talk to researchers, students, and practitioners about their experiences using AI-assisted screening with AS Review, the highs, the hurdles, and everything in between. Whether you're deep into systematic reviews or just curious about how an algorithm ended up helping with your reading list, you're in the right place. Today, we're joined by Elena and Kianush, both master students at the Research Master Psychology at the University of Amsterdam and also junior researchers at AS Review. Welcome to both of you.
Thank you.
Thank you for having us.
Hi.
Yeah, and I'm so interested because you're both from Germany, right?
That's
Yes,
right.
that's
And then you
correct.
study in Amsterdam to be active in Utrecht at AS Review.
Yeah.
So what's your journey?
So I came to the Netherlands to study psychology for my bachelor's already 5 years ago. And then after I started the research master, and that's where I met Rutger, who did his bachelor thesis at AS Review. And he kind of introduced me to, the lab and to AS Review. And then there was a job available at AS Review, and I applied. And then I was really happy to get it. So that's how I ended up in Utrecht at the AS Review lab.
Great. And what about you, Kianush? What was the first thing you did at AS Review?
Well, first I learned a little bit about the software and everything, just getting settled, doing the ACE Review Academy onboarding stuff. And I thought, I'm kind of managing. It's nice. It's a good environment. And then at some point I got an email from Rens saying, there's this big EU-funded Improve project, something about healthcare. And there's a plenary meeting in Madrid in a month. So we need people to go there. And so I thought, okay, so I'm going to help prepare for that, maybe make some slides or something. And then he said, you can book your flight. We're, shipping out next month. And then, next month I was sitting at the university in Madrid and interacting with all these people from the consortium. And it was, amazing.
Oh, great adventure. Did
yeah.
ELAS join you on the adventure?
Of course, always in my pocket.
Always. Which one? Which ELAS?
I'm very partial to the Tron ELAS. I think Laurens did a really, really good job with those. So
Can you explain more? Show it, the Tron ELAS.
Laurens, who also used to work at AS Review, he really loves the movie Tron, specifically the remake. And he just designed this. There's an orange and a blue version, and he made them as a little fan tribute, I think.
But you both also explored another kind of journey, namely the Screenathon.
Yes.
Can you tell me a little bit more? What is that? I know a marathon, and I know screening, but
Yeah. Well, you're not far off. Actually, the word Screenathon, we kind of derived it from the word hackathon. So that's kind of when you sit together with a bunch of coders and you try to find a solution to a problem that you want to find a code for in a very short amount of time.
Yeah.
And that's basically what we did with screening. So we had the issue that for this big EU project, we wanted to have a big literature base, and we needed to get that done in short amount of time. So we sat together and we were like, what can we do to make this a bit more fun than everyone just individually screening at home and reading all of these papers, seeing if they're relevant or not.
Yeah.
So we thought, how can we do this in, 2 or 3 days and get everyone together and do it as a fun event instead of, just everyone individually.
Yeah.
So we came up with the idea that, we do this crowdsourced screening, which means that everyone from the consortium that is available gets together in one place and does screening in a very short amount of time. And then at the end, we are all done with the literature base.
Oh, and Kianush, can you tell me a little bit more? What did it look like? It was in May last year, right? If I'm not mistaken.
That's right. What it looked
And where did
like-
the people come from? Were they all Dutchies or from whole Europe?
No, all over the place. So the Improve consortium, I think, has 26. I'm looking at Rens, 26 partners from all over the place in Europe. So there's also very different kinds of stakeholders involved, right? So you have universities, you have hospitals, you have companies, and they're sort of all tasked to work together to figure out something about how to use patient-generated health data, how to use it better within the EU healthcare system infrastructure. And so as Elena said, we just sent out invitations to basically everyone and said, well, we're doing this event. It's going to be fun. It's going to be very useful for the consortium. And, well, you're all going to learn a little bit more than you maybe usually would also about the evidence base of the project, right? What science this actually is based on. And a lot of people were interested and came to Utrecht. And then we had 3 days of events and screening and meetings.
So when looking back at this whole event of 3 days, what was the highlight, the most important day maybe?
Yeah, I think, most important day and special day, I think all three were special, definitely. But the most important day, I would say, is probably day one. Because that's where we get together for the first time and everyone kind of meets each other. Also, well, they have met sometimes at the plenary meetings, but they meet and see who's going to be at the Screenathon. So that's kind of where the community building sort of starts. And that's also where we have the first training and calibration session for the Screenathon, which is really important because that's where we discuss the inclusion and exclusion criteria for which records will be relevant or irrelevant during the screening. And it's also very important because that's where we kind of come to a consensus with the consortium of what those criteria really should look like and how we should formulate them, because everyone kind of still has a say in whether these criteria are understandable enough for everyone to do the screening at the same level, and also to make sure that the quality is the same between all the screeners of the consortium.
Yeah. I'm very curious because I would think like screening for me is the least interesting part of doing research. Yeah. I have to do it. So why would I travel all the way to Utrecht to do screening?
Yeah, and how many papers did they have to screen?
And how many papers indeed? Because you said many people were interested and you even mentioned the word fun. So I'm very curious if we can make this fun.
So actually it was about, I'd say, between 12,000 and 13,000 papers that we had to screen.
They all had to be screened by a human?
No, they had to be completely screened by humans. So we had to go through all of them.
So all of them were seen by a human?
Yes, exactly.
So that's different from other users of ACE Review who might not see all the papers, but all of them were seen.
So 12,000 papers in 2 days. Oh my God.
I also had to screen 12,000, but luckily I only had to screen 1,200 in the end.
Yeah, well, you could imagine that if you do know that you have to go through all of them individually, then you're already like, oh, do I even want to start this?
Exactly.
But for us, it was kind of the idea that even though we have to go through them individually, we want to make it as fun as possible. Yeah. And to do that, we did use the AS Review interface, just without the active learning. So the active learning was not activated during the screening. That is why not everyone saw the papers, but we looked through all the papers.
And how many researchers participated?
I think it was around 35. I would say.
It was hybrid as well, so it's a bit hard to say. We had some people join for a day online, other people were there.
That was also, so it's all very flexible. So how did you host that? Was it also online or how does that work?
Yeah, we had these kind of hubs, I would say. At each event, we always had like a room or a space where we had like our base, sort of. Yeah. We also had the people that would join online on a screen, and they could talk to us, ask questions. And also the people that were screening at the time on site, they could also come to us if they had questions, because we would be there at the kind of hub. And it was nice because we did go to different locations as well, which was kind of what made it that fun, because we integrated a lot of events and tours, like touristy things, in our Screenathon event as well. So we went up to the Dome Tower in Utrecht, which is very high. It's the highest point in Utrecht. Actually the highest point in the Netherlands, I think. So we made it possible for everyone to take their phone and also be able to screen on their phone.
Wow, that's great.
And then we kind of expected that after going up the stairs you would want to enjoy the view over Utrecht, but everyone was just on their phone trying to screen as many articles as possible. So
kind of gamified. I want to have the maximum score.
Yeah, there was a prize to win.
There was what was the prize?
Yeah, we actually, when people were around the hub areas doing their screening, the organization team, we went around and we bought some little souvenirs and stuff from Utrecht, mugs and shirts and stuff like that.
It probably doesn't even matter. You want to win, right?
Yeah, of course. And there was a big ceremony at the end, where we showed off why this person now got this prize, and everyone was very engaged.
So you have 3 days with over 30 people working their ass off to win the prize and scan like 13,000 articles.
Yeah.
But what's the result of all of that? And can we read something about that? Like, what do we do it for?
Well, there's plenty to read. We've been writing about the Screenathon and thinking about the Screenathon quite a bit since that event. But I mean, the big point is that we got through all the articles, the records, and I think people were, based on some surveys that we did, relatively happy doing it as well, which for us is also very important, of course, with the social goals. And so now, this evidence base that was established, these records, they actually flow straight into the project. So we're sort of at the beginning of this really big EU-funded project, and then using this evidence base now, it kind of feeds in and hopefully will help for some good outcomes with this project.
Yeah, especially because the Improve project really focuses on making a better framework for patient-generated healthcare data.
Yes.
And we kind of form the basis of the literature that goes into that. Yeah. So we kind of call it a knowledge warehouse.
Yeah, exactly. And, nice metaphor.
Yeah, and that's what all the other work packages in the consortium can use later on to finish the project and develop the project a bit further. Yeah. And that's done now.
Do you have any advice for those who are listening and think, that sounds very cool. I also have this massive amount of papers to screen. I want to organize a Screenathon. What's your advice to those people?
I think what I've learned is that a lot of it is about like expectation management, both for yourself, but also for the attendees, right? Because, of course, as scientists, we have a certain idea of what screening is supposed to do and how it works and how it looks and how it feels. And the Screenathon kind of challenges those ideas a little bit. And it's the same for the attendees, but for them, it's even more complex because some of them are scientists, but some of them work at companies. Others are healthcare professionals in the case of Improve, for example. So it's really important to be very clear from the get-go, right? On day one already to say, okay, so we're not here to do it necessarily as fast as possible. Just go at it at your own pace. If you don't manage to finish your batch, that's fine. It's more important that you sort of understand what you're doing, that you talk to other people about it. So I think it's very important to set that frame and kind of communicate well what the goals of the Screenathon are, and that it's nice that we got through all the records, but if we didn't, it would still have been a success.
Yeah,
right?
still be valuable.
Yeah, I agree. I also think it's really important to kind of communicate that it will be a really fun event. Like
also, exactly.
You're not only going there to screen, like a lot of people as you said, they don't really like the part of screening. So make sure that everyone really knows that there's going to be some fun events involved, some sightseeing maybe of the place you're going to, especially if it's from people all around Europe or all around the world even. You could make it a bit more geared towards looking at the actual city you're doing the event in or things like that. I think that can really help motivate people to come and also really motivate to help screen as much as possible.
Vance, are there also any technical requirements and maybe in the new version of AS Review that could support these kind of events?
Yeah, so realize that AS Review can be installed locally on your laptop, but for a Screenathon to work, you have to install AS Review on the server so that every user or every participant can actually log into the server via their mobile phone. So there are a lot of server requirements for a Screenathon. But luckily, we have a lot of documentation to help people.
That's great for all the listeners. And what do you think is the relation between screening as a community and the quality of the screening decisions?
Yeah, I think you have to be a bit careful because especially if you have some prices involved, it might be that people want to just get done, get done as soon as possible, so they might not read very carefully. But what we did also is we didn't really tell them what the prices were for, so that kind of took away the feeling of wanting to rush to get the fastest batch screened or something like that. And also we have some quality checks that we do after the screening is done. So we have someone who screens all the papers that were excluded to see if we missed any that might be relevant. And we have a bunch of quality checks, maybe.
But I can also imagine that if you have clarifying questions in between, which you can directly discuss with peers, that could also maybe enhance the quality.
Yeah. The nice thing about the Screenathon is that well, we have these 4 pillars in the paper. We talk about it. So you, on the one hand, want to do the things you traditionally do in a screening. You want like a high quality but fast screening of a lot of records.
Yeah.
Because we're sort of designing this for big groups, big team science kind of setting. So lots of papers involved, but not that much time. But at the same time, we have the other half of the pillars, which are more social. So they're about community building and sort of consensus forming, we call it. Because what can happen in these consortia is that there's a lot of people involved and, well, they meet maybe once a year or twice a year in person and talk a little bit and have these very structured meetings. But they might not really get a lot of time to feel like a research community and to kind of share the insights that don't really come up in like these structured meetings. So a big thing that we're always cautioning people about is that with the Screenathon, you get the screening, but there's also those social goals, and depending on your needs, right, you can emphasize one or the other. Ideally, you manage to do everything, of course.
Yeah. So last time we had to read 12,000 papers.
Yeah.
And we have labels for all of the records, right? So we can run a simulation study to mimic what if we would have used active AI, active learning, right? So what were the results?
It was actually very, I wouldn't say it was like depressing, but it was a bit surprising, I would say, because we actually only would have had to read through, I think, 500 abstracts instead of the 12,000.
So what was the reason to begin with that you said, okay, we want to see them all as a human? Because it was already available, active learning. So what was the reason for this consortium to make that choice?
I think at the time it was about having a data set where we could really say, okay, this is the first time we're doing a Screenathon. This is like our first big deliverable for the project. Yeah. We really want to have also a lot of training data available later on where we know, okay, a person, an expert maybe has seen this and has made the decision. And then all that data now we have sort of in our back pocket and we can always use it.
And now we can actually make this conclusion because we have the data.
Yeah, and also because we have that data now, the next Screenathon will be way easier because we can train a model on that. Those labels that we have already, and then now for the update that we're doing in Italy, we can actually use active learning because we have the labels by experts.
For example, when I want to start a Screenathon on a new project, maybe I can also say, now I will just use active learning directly because you have actually showed that at least in the field of psychology and similar fields, maybe it's fine to use active learning.
Yeah, I mean, in this case, in the healthcare sector, I think we've shown that it is way more time effective to use the active learning, and it is also possible. So if you are trying to do a Screenathon, it is possible to do it from the get-go with the active learning and make it even more time effective than we did last year. Similar to the one that we will do now in Italy, I would say.
I think it's time to go on adventure with ELAS. We have a lot of stickers, as you might know, of ELAS going on various kind of adventures, like a baseball player. And our previous guest wanted ELAS playing chess or checkers. Do you have any wishes for ELAS for their next adventure?
Yeah, I mean, we're going on an adventure soon with ELAS to Italy. So we're doing another Screenathon, which is kind of the update to the previous year. We're going to screen some more articles there. And I think in that regard, maybe a Italy-themed ELAS would be very nice.
Very nice. So ELAS going to Italy. That brings us to the end of this episode of Inside ELAS. If you enjoyed this episode, share it with your fellow researchers, supervisors, or that one colleague who still screens everything manually. See you. For more stories, updates, and insights, follow us and stay tuned. ELAS can't wait to expand its community, making its little digital heart positively pulsing in binary with joy.